Okay, based on your reading, I want you to take a look at this slide and start to ask yourself. You should have done the study questions, so you might want to refer back to that. I want you to try to identify the difference between arterial sclerosis and atherosclerosis. However you can remember, arteriosclerosis is a thickening or hardening of the artery wall, and it's often just associated with the normal aging process. The other one is atherosclerosis. The exact pathophysiology is not really clear, but it's thought that it occurs from blood vessel damage. Factors such as abnormal lipid panels, so like we just talked about on previous slides, high cholesterol, injuries from toxins, genetic predisposition, so if your parent had it and their parent had it, it's likely that you would have it. Diabetes is another contributing factor for atherosclerosis. So that's the main difference. One can happen, arterio can be a normal process, just the wear and tear on the arteries, they start to thicken and harden. Then atherosclerosis, there is some modifiable and some not modifiable risk factors that contribute to that. So some other things that I want you to think about, we're going to go through on these future slides here, but what are some interventions for a patient with arterial sclerosis or atherosclerosis? How can this disease be prevented, and what is the risk of the disease? For the atherosclerosis, it's a gradual thickening and narrowing of the arterial lumen. There's hardening of the arteries. There's either stable or unstable plaque. Stable plaque can rupture. A clot from the vessel lumen can cause decreased perfusion. Unstable plaque can rupture and expose the lining of the artery, causing a rapid clot to form, and can actually occlude the blood vessel because of it, causing ischemia or infarction or a heart attack. So if you think back to the slide of the heart with the coronary arteries and how I said if there's thickening or narrowing or ischemia or injury to those, that is what is happening during a heart attack. Okay, let's go through these next couple of slides, and hopefully we can answer these questions that are on this slide. Okay, so I kind of already went over this in the previous slide, but in review, arteriosclerosis, it can be a natural aging process. Just if you can, I don't know how to help you think of those differently, but if you think arterio or artery is natural, then maybe that will help you think that that's the natural aging or thickening of the artery walls, whereas atherosclerosis is not. Not everyone gets atherosclerosis. It's not part of aging, and like we mentioned in the previous slide, there's risk factors involved with that. The etiology or pathophysiology is not 100% clear, but there are things that can help with that, like controlling cholesterol levels. You can't control your genetic disposition. If you're a diabetic, having tight glycemic control can help with that. If you're obese, by losing weight, which naturally, if you're watching your diet and you're watching for your cholesterol and you're trying to maintain glycemic control, naturally, all those things will help contribute. Smoking, sedentary lifestyle, stress, all of those things. So here's just a summary of the previous slide as we discussed, but I want you to somehow commit this to memory and have an understanding of that. Your thickening of the walls can cause occlusions, whereas the type of atherosclerosis can involve plaque formation. So that plaque can completely occlude or it can migrate. Pieces of plaque can move off, and we'll talk about that later, excuse me, in acute arterial occlusions. Okay, this is a picture of, to give you an idea of what's happening in atherosclerosis. This top left circle that is a magnified version of that artery there, it shows 50% blockage of that artery, so you can see what that looks like. The bottom left is 30% blockage, the top right is 99%, and the bottom right is 90%. So that can give you an idea. These are the only way that doctors are able to get in there and to look at this is to actually have a patient go in for a cardiac catheterization. And they are able to use a dye through they usually go in through the groin, and they can shoot a dye through the vessels, and they can see where the occlusion is. They can take pictures of it. So this is for atherosclerosis. So this is one that has modifiable and non-modifiable risk factors, meaning there can be something that you can do to help prevent it, or there can't be. This is why it's important for us to teach patients about how to modify their lifestyles, how to change their diet, how to decrease their cholesterol levels, especially if they have family history or known family history, because then they can't change that. So they need to make a conscious effort to make other changes to prevent further complications. This slide here came from your book. I really like this slide, but I like even more some of the points that it makes in the notes below. So it talks about pathophysiology of atherosclerosis, how it came to be, and then discuss what you would be assessing for in a patient that has atherosclerosis. So why would you want to monitor their blood pressure? What would you expect their blood pressure findings to be? Palpate pulses on all major sites of the body. Why would you want to assess all major sites? So if you're having plaque buildup in arteries, then it's very important when you're, in assessment, we teach you to compare side to side, top to bottom. Well, if you're feeling radial pulses or pedal pulses or popliteal pulses in a patient with known atherosclerosis, you want to know, is one side weaker than the other? Is there, potentially, remember, all your assessment is telling you a story about your patient. Is it telling you that maybe we have some plaque buildup on, one part of the body more than the other? Assess for prolonged capillary refill. Again, what does it mean to have capillary refill less than 3? We know it's important to assess for, and we know that it should be less than 3. But what happens if it is longer than 3, and what is happening with my patient because of that? Also to assess for bruit. And we talked about that, hopefully we talked about that in health assessment, on how you can actually lay the stethoscope over the carotid arteries, and you can actually listen for and assess for a swishing sound. That would be the bruit, and that would let you know that there's stenosis or narrowing in those carotid arteries. So I like this visual, the picture, and I like the notes that focus on the different assessment findings specific to a patient with atherosclerosis. Okay, this is an example of arteriosclerosis. So this is something that happens naturally over time. So it kind of gives you an example of the normal layers of the artery and how those can actually thicken or harden with the aging process. So the progression of arteriosclerosis is influenced by these particular risk factors. A lot of these, like we said, take a look and see what's modifiable or non-modifiable. Your cholesterol levels can be modifiable through diet and exercise, and even through medication. So the next slide will go over those drug therapies or statin medications. Genetic predisposition is non-modifiable. You can't do anything about um, genes. Diabetes mellitus, again, if it's good, if your blood sugars are controlled, you're trying to avoid having big fluctuations in your blood sugar. So if you're following a good diet and taking your medications appropriately, it's a little bit more, it's a modifiable risk factor in that it won't contribute to the atherosclerosis as severely as if you're an uncontrolled diabetic. Obesity is modifiable. Sedentary lifestyle would be modifiable. Smoking is modifiable. Stress technically is modifiable if you can learn how to handle stress or behavioral therapy so that people don't stay stressed all the time. Your ethnic background is non-modifiable, and being an older adult is non-modifiable. So when working with patients that are at risk for this or have early stages of this, you really want to focus your education on the things that they can modify. You want them to know how important it is to quit smoking, how important it is to lose weight, how important it is to control their blood glucose levels if they're diabetic. So these are some of the risk factors for atherosclerosis. This is just reiterating a little bit about what I was talking about in the prior slide. So interventions that you want to do would be to educate on increasing fruits and vegetables, specifically vegetables. Also decreasing their sweets or carbohydrates or processed foods, sweetened drinks, decreased eating red meats, and consuming a low-fat, to choose low-fat dairy products and low-fat lean meats. Let's see, increased physical activity. And then here's some of the drug therapies that we talked about. You have to be careful with statin medications. Some of them can be very toxic to the liver. So if a patient's starting one of these new statin medications, you want to make sure that you provide good patient education about the medication, how to take it, signs and symptoms if they're having adverse reactions to it. So you'll want to know these statin medications. For testing purposes, you'll go in more detail. This isn't a pharmacology class, but we do want to talk about anti-lipid medications and why you would give it to a patient. So the first, if you have a patient that comes in with high cholesterol, the doctor will first try to educate them and tell them, hey, cholesterol's high, you need to change your diet, you need to change your exercise, you need to follow this plan, come back in a few months and we'll recheck it. If it maintains high and the changes have been made, then they'd want to introduce drug therapy.